All right, so we're going to get started with our Leadership Series 2.0, which is a STEM to Innovate initiative. This is an initiative to empower the community members and also highlight some of the great things that are happening in our community. And so we're going to get started with one of our member guests today, who we are very highly honored to have his acceptance to come to our show and be able to provide some insights, specifically in today's pandemic that we all are, somehow indirectly or directly impacted by it. We want to be able to share some things that we can do in today's times, especially the advices that Dr. Asim Shah, who's going to be joined shortly with us, will be providing on how to lead your child effectively during pandemic. He will be providing some key specific solutions and insights on how we can further, as parents, be effective with leading our child effectively. I want to give a quick background on Dr. Asim Shah. Dr. Asim Shah has been a key individual when it comes to psychiatry, dealing with so many issues in the community. He's definitely one of the individuals to look up to. He holds a Barbara and Corbin Robertson Chair in Psychiatry and is Executive Vice Chair and Professor of Psychiatry, Family and Community Medicine at Baylor College of Medicine, Houston, Texas, and Chief Psychiatry for Bentov Hospital and Harris Health System. He is also Chief of Division of Community Psychiatry and Director of Mood Disorder Research Program at Ben Hospital. He has done numerous media presentations, some of which were on a Pakistani, he's one of the Pakistani psychiatrists who's seen on Fox, as we all have seen, in NBC, CBS, ABS, NPR, PBS, and CNN. Definitely an individual with so many presentations provided in the radio, TV, newspaper. Dr. Shah has over 100 peer-reviewed articles and publications. He has definitely won an award for Fulbright and Jaworski Award for Teaching Evaluation in 2012. He has received numerous other awards, such as Rising Star and Clinical Award in Baylor 2014. Received Castle County's Top Doctor Award from 2017 to 2020. He received Children Mental Health Champion Award for Mental Health American 2018, and Texana Center Board of Trustee in August 2019. He's been part of that as a first South Asian. He's currently chair for Mental Health America Houston, and Dr. Shah has also received the prestigious Clark Faculty Service Award, which is huge. So without further ado, let's listen to Dr. Asim Shah. How are you? Welcome to the Leadership Series.
Thank you for your kind introduction.
Thank you so much for joining. I really appreciate it. I think this is going to be a great presentation that you have lined up for our audience and members and followers. I'm pretty sure as people are joining in, we're going to further, add to some of the great things you are going to provide, and the value you're providing is amazing for the community, and really appreciate that community service that you're providing. That speaks volume as a leader.
My pleasure, always.
Thank you so much, Dr. Asim Shah. So I would like to just kind of ask a few questions just to kind of get started, and then we can definitely share our screens and provide the presentation. So I know that living in Houston, Texas, Sugar Land specifically, I do believe that no matter what we say, there's so less number of, things that we see, especially with the death toll and the cases. But I do believe that somehow we all are, even we're safe and we might be healthy, but we are somehow indirectly impacted by it, if not directly, right?
Yeah.
So what's your, as a leader, and I know that you've been in the trenches, you're on TV, you're on media, you've been, communicating in different meetings, town halls, and you're doing so much out there trying to advise to the members of the community on particular areas. So that's something that I would like to hear from you today as well in the presentation. And also as a servant leader that you are, which I highly believe this whole leadership series is about, highlighting those key one of the key things that are happening in our community. So, as a servant leader, what is your first takeaway from all of this that's happening in the community locally, and how do you go about in ensuring that we are going to be, okay, maybe? And I know nobody have the answers. We're looking up to the leaders. But there's so much uncertainty today. So what's your current perspective there? Just want to give a quick start-off point there.
Quickly, what I can say is that, of course, this is something nobody has ever faced. This is a pandemic which last was 1918, and I don't think anybody is alive anymore who was alive in 1980. I also wish and hope that this is the last of the series we are seeing, and we don't ever see this thing again. Having said all of that, this is an evolving problem. This is not a problem one can expect. This is not a problem one knows what to do. It's changing. We need to be united. We need to be understanding. We need to care for each other. Because if we are selfish and only caring for ourselves, that's not good. If you see a neighbor who is in need, help them. If you see an elderly who is in need, help them. If you see somebody who's financially struggling, help them. This is the time, as we always say proudly, Houston strong. This is the time we need to show that Houston really is strong. And we are strong. Our community is strong. We are strong, and we will help not only our community, but others. So that's the only thing I would say, because truly everybody knows what to do, but people don't follow. We can talk about it when we talk about the specifics. But truly the one thing is, disasters like this bring people together. That is the positive impact, and people become more united. We need to take that as an opportunity to be united and caring for each other.
Absolutely. I think that's the key takeaway, that being compassionate at this point, whether with whatever hats we wear, whatever field and positions we hold, and at all levels, professional and personal level, we just need to be very passionate at this point. You really hit right there on the nail. Let's kind of further move and talk about, I know that you were covering a whole lot of things in your presentation today, and I know that we also have limited time for this leadership series. So I think we can segue into it. We're also going to open floor for questions. If there are going to be questions, we can take away those as well. So I think without further ado, Dr. Shah, let's get started with the presentation you have for today.
Sure. You can see my screen?
All right. Yes, I do now. Perfect.
Good. So today what we're going to talk about is basically what can parent leadership do during this pandemic? What can a person do? And it really matters how we do things, because it's extremely important for parents to see leadership from, for kids to see leadership from the parents. So, few basic things. In order for any leader to be effective, the 5 things which are extremely important are listed in this slide. Of course, clarity. You need to be decisive. You need to be courageous. You need to be passionate. And last, which is to me the most important, is the humility. And we see clarity, we see decisiveness, but we sometimes don't see courage, passion, and humility. And those are very, very important features of any leader. And I'll give you some examples how we can apply this in our homes, and what can we do. So think about the first one, which is clarity. As a parent, our job is to listen to the concerns of our kids and everybody, but we need to stay calm. Clear message means that we don't try to change attention in terms of blame game. What we see a lot in our families, that people are trying to blame things. Oh, this happened because of A, this happened because of B. We even see this in our leaders. No, blame game at any time of need is not the best thing. It's the worst thing. So when you are in stress, when you are in a disaster, when you are in a pandemic, we need to show and be united. No blame game. We need to be calm. We need to pay attention to what others are saying. And also we need to be honest. Honesty means we don't need to hide things. We need to show things as is. The worst we do is when kids come around, news media or a television screen you are watching, as soon as they come around, you change the channel. Why do we change the channel? We don't need to hide from them. If we feel it is that bad, don't even listen to that media channel when they are at home, or they can come. But if they're there, if you're hiding it, that's not being honest, and they will be concerned, what are you hiding? And also we need to be available. So be So we need to try to have a consistent, positive, clear message and don't try to blame things on others. The second thing is we need to show to our kids that we are decisive, we can make a decision, and not only we can make a decision, we will stick to that decision. We are not going to change. We won't change every minute or every fraction of a second. So how can we do that? Examples can be, if we tell our kids that, you need to mask up, which is the campaign right now happening in Fort Bend and in Harris County, we shouldn't be changing it that, oh, if you go there and that place, if you don't mask up, that is okay. We need to be consistent with the message that you need to mask up with everybody who you don't know. And if you are in a place where you will come close to somebody less than 6 feet, consistent message, and make a decision and be firm on that decision. We need to be consistent on the same thing, that if we're doing physical distancing, it needs to be 6 feet. It shouldn't be 2 feet for people of your choice and others. We need to again be decisive that we need to wash hands, and we should be the role model. When we go home, we need to wash our hands first so that the kids see that. If we tell our child don't watch news media, then, as I said before, we don't need to be watching the news media in front of them. So all those things go from the top. Leaders need to portray the same behavior as they want others to follow. So if you don't want them to watch news, you need to do the same. Again, courageous. What can we do? So in this time, the examples could be that we need to have the courage to show them how we are avoiding the blame game, how we are using the mask, what we are doing in terms of hygiene, and how we practice physical distancing. Because if we are going to show them, it's going to be followed by them too. We see politicians, whether it is in Pakistan or everywhere, wearing no mask. That's not a good message. We see, if kids are going to see, for example, their principal, their parent not wearing a mask, not washing hands, that's not going to be a good role model. So we need to show them what a good role model is. Passion is important. We need to talk about things with passion. We need to show some discipline. We don't need to make fun of people who are wearing a mask, whether the mask is making them look bad or good. This is a necessity for today. Everybody has to wear a mask. So we need to be passionate about that, and we need to show some discipline. Then other thing is, we need to remember that in today's day and age, when we have a pandemic, some panic is normal, right? So we cannot control the panic, but what we can do is we can control excessive panic. So some panic is normal, but if somebody becomes panicky to the point that they are unable to function, we can control that. Actually, if people are not anxious today, that is more questionable than why they are not having any anxiety, because some anxiety is completely normal in these days. Humility. That is perhaps the most important characteristic of a leader. You need to show humility. You need to show care for others, genuine care, not to show and take a picture. What we see a lot of time is people are showing care just to take a picture and put it on social media. No, you need to care for people, literally, genuinely. Like in this example, you can think about people in high risk, people who are first responders, people who have medical problem, people who are your elderly neighbors. What are we doing to help them? Are we helping them in some way? Are we appreciating the first responder? Are we doing the right things we need to do? Maybe buying them groceries, doing their chores outside. We all need to do those kind of things and show humility and care. That is being a good role model for our child, and that goes a long ways. Now, as a leader, what can we show our kids, or how can we tell our kids to reduce this panic and anxiety, which everybody has right now? And again, rightfully so. So there are a few ways which are listed here. First is, of course, we should try to limit news exposure. News exposure is extremely important, and it's even more important for kids younger than 5. Why? Kids younger than 5 always think that what is happening on TV is real. And if the same image comes 2 times, 3 times, 4 times, 5 times, which news media does, they feel the same image is happening again and again and again. So less than 5, no news media coverage is the best, we feel. More than 5, maybe a little bit of news coverage is okay, but not the whole day you are clicked to a news channel and kids are watching that. That's very depressing, even for adults. Forget about kids. The other thing is apps. What are we doing? How are we using apps to engage? And we'll talk about that, touch up that more so. But we can use apps to engage more so than not. Social media. A lot of time people use WhatsApp. And I've said it numerous times, but WhatsApp perhaps is the worst example of spreading wrong rumors on social media, because people tend to forward anything they get without even verifying the source, and it's forwarded and forwarded and forwarded, and people get more panicky. And last is hoarding. When we hoard things, somebody goes to shop and they see the aisles empty, that's where they get panicky that, oh, things are going to be out. There is no indication that grocery is going to be out, or your necessities are not going to be available, or gas is going to be not available. There's no proof of that. So we don't need to hoard things. Having things for a 1 week, 2 week is perfectly fine, but we don't need to hoard for 6 months. So, what warning signs we can see in kids when they are stressed, when they are anxious, or if they are getting, depressed due to this pandemic? The signs are listed in this slide. So, in short, what you will see is you will see kids maybe crying or getting irritated at a younger stage. You will see them returning to behaviors they have outgrown, like toileting, bedwetting, those kind of things. You will also see them becoming excessively worried and sad. You will see them having unhealthy eating or sleeping habits, sleeping late, waking up late. You will see them acting out, especially the teens. If the schools are open, you will see poor performance. You will see them not able to focus and concentrate. You will see them avoiding activities they used to enjoy in the past. And also you will see unexplained headache or body pain. And lastly, some kids, teenagers especially, can resort to drug and alcohol usage or cigarette smoking. And these all are warning signs we as a parent, as a caregiver, as a family need to observe. And if we see that, we need to give them some help. I mentioned high-risk group earlier. I'll mention them again. These are the 4 high-risk group, which is elderly people, people with chronic illnesses like diabetes, high blood pressure, asthma, immunocompromised state, first responders, which could be healthcare workers, nurses, and even people who are working in grocery stores are considered first responders right now to some extent, and kids. Again, if we want to teach our kids coping techniques during COVID-19, I'll mention some apps also, but before I mention that, these are some tips which are listed on this slide. We would like to encourage them to eat healthy, because right now people are at home. Because they're at home, they're eating unhealthy. Unhealthy meaning we don't want people to gain 20 pounds of weight after this pandemic is over. So we need to exercise. Gyms are opening up. We need to sleep well. We need to avoid drug and alcohol. We need to try to connect with people, and I'll mention that in detail a little bit later. We need to try to take breaks. Staying informed is good, and we need to be positive and optimistic. And when none of these things are working, that is the time perhaps when we need to ask for help from a professional, whether it is a social worker, a therapist, a psychologist, or a psychiatrist. So these are the mental health apps which are available. The reason I mention that is that a lot of time kids prefer apps. They get more help from apps than anything else. And the apps listed are, there's an app called What's Up, not WhatsApp. It is an app for depression and anxiety. Then we have an app called Mood Kit. This is also a CBT app for depression and anxiety. These are all, by the way, free apps. Then we have Mind Shift for kids with anxiety, or Self-Help for anxiety management, or Talkspace for depression. We have PTSD Coach. We have Intimate, which is more in Spanish language. We have another for African American diaspora, which is Liberate. And then the last 3 apps, Headspace, Calm, and Simple Habit, are available in free, but also in subscription mode, which is a little upgraded mode. What are the mental health resources? These are the mental health resources which are available, which are listed. One thing I would like to mention, that kids, when you don't see human beings, and human beings both, even adults, we develop touch starvation. How can we avoid touch starvation? The only way to avoid touch starvation is we need to connect with people with video. That is the best way to connect. And the connection with video can be that we can do FaceTime, we can do Zoom, we can do any other thing, but we need to connect. And connecting with video gives almost the same benefit as you will have in person seeing somebody. So that's extremely important. In terms of mental health resources listed here, there's a suicide hotline, there's a COVID mental health support line listed. If you live in Fort Bend County, people can go and see Texana, even if they don't have any resources. Same thing if you live in Harris County, Harris Center, Harris Health, both are available. Then for subsidized rate, you have at Messina and Legacy. So a lot of things are available there. And with this, I'm going to stop and ask if there is any question. I know our time was short, so I try to finish it in the 20-minute which we discussed. So please go ahead. If there's any question, I'm happy to answer.
Thank you for that awesome presentation, Dr. Asim Shah. I think that was really amazing insights you provided there, especially on those apps. I think I would like to check out some of those apps that you have suggested for the parents to look into, especially so much time that we have at home.
So this presentation is available on Facebook. People can go and look at the app slide. I think it was on minute number 18.
Absolutely. Yeah, I think that was one of the slides. Some really great apps. I think I want to check those out for sure. I think we can also take questions for individuals that want to come and provide any questions. We can open floor for that as well. But one thing I'm learning as we have this whole thing going on, I do believe that parents have to play a key role for sure. Just like you stated, looking out for those particular signs of anxiety, maybe could lead to depression. So I think as a parent, I know that different age groups, maybe ones that are very little. What do you think about the little ones specifically? Like, for example, less than 7 or 8 years of age.
Less than 5, usually less than 5 or 6 is the most vulnerable time. So you need to avoid things. You need to avoid the media coverage and all of that. Now, when they are over 6, usually they are beginning to learn things. So for them, they're very curious. So they ask questions. So you better be prepared for answers. And the answers need to be honest answers. We don't need to give them made up answers. Why? Because these days, kids find out everything from social media. And if you don't give them honest answers, they lose trust in you. They're not going to ask you. So give them honest answers and engage them in conversation and see what is bothering them, what is their fear. So definitely do that for them.
Absolutely.
And it can be a problem-solving group, because they can problem solve by providing us more, for example, apps, more video channels, more ways to connect with each other. They know those things more than I do it, at least. Maybe you don't, but more than I do. They know those things more. Teenagers are very, these days into it.
Absolutely. So there's a question came from Mr. Kaisar Imam, one of our community members. Should the young children be allowed to start having in-person interactions as long as they practice social distancing? That is one of the questions, and there's 2 other questions. Maybe you can answer this one first, and then we can lead to the second question there.
Go to this one first. So we all know right now that this pandemic is not going anywhere, at least in the near future, right? Some say it will be here the whole year, the rest of the year. Some say it will be here another year, which is kind of till spring of next year. If we know that this is going to be here that long, there's no way we can avoid seeing people. We have to see people. And we already go out and see people, whether it is for grocery or for gas or for doctor or for work. So we will be doing that. So in terms of kids, if you feel kids are able to understand what physical distancing is, first of all, I don't like to use the word social distancing, because it is not social distancing, it is physical distancing. We want people to socialize. So if you feel that they will be physically distant, that's okay. Now, the second thing is, there is one group of friends or family you have who you trust more. Hypothetically, if you know somebody who's your neighbor, your cousin, your family, you know that when they come to see you, they will perhaps take a shower, they have washed their hands, they will wash their hands repeatedly. You can trust them more than somebody who you don't know at all. So your trusted group of friends, family, relatives, if you are socializing and the distance is even less than 6 feet, perhaps it's okay. If you're socializing with people who you don't know enough, you need to keep a distance, you need to wear a mask and do that. So you can change that based. And some studies are even talking about less than 3 feet. So there was a question raised earlier today on social media that why do we have to wear a mask? Masking is fine if you are with somebody less than 6 feet, even if you don't know them. But if you know them, you can perhaps alter it a little bit more so. So that's your first question.
Mm-hmm. Thanks for that response there. And another question came, which is still by Mr. Imam. Kids wanting to see their friends now, and they're seeing business places like bars filling up. So are they going to be confused about that?
They are. They are certainly already confused about it because they're seeing the wrong message. They're also confused when they see our political leaders not wearing a mask. So they get confused. Absolutely. And this is the biggest challenge because opening the economy is perhaps a very good idea. We should open because people are losing job and money and all of that. But it doesn't mean that you don't need to mask up. We need to mask up. We need to do both together. And we need to be the role model in doing that. So again, you can avoid doing that in a population which is a restricted population and like your family and others. But when you go out for strangers, absolutely.
Thanks for that. So yeah, physical distancing is, I think, the key takeaway here, for sure. You can still socialize. You can socialize online, virtually, but physical distancing is definitely the right terminology there. I think that we all should use there. Also, another question came. This one is more regards to what do you suggest for the high schoolers who are so much out there, specifically in their they want to be out and about like social butterflies that they are. How can they continue to keep themselves entertained and still be able to practice physical distancing? Any particular advices do you
You
have
know,
there?
it's hard to restrain them today because we know the gyms are opening. Governor announced today is going to open some sports, so things are opening. So you cannot restrain them because you will be saying something which is not happening in your surroundings. But they need to still exercise some caution. I think the take-home message is if we are going out, if we are seeing things, doing things, we need to take it a little slowly. Maybe go out first with the people you know. If you go out around people and you're playing with people who you don't know, that is the time you need to wash your hands, use a sanitizer, come and take a shower, don't touch your face, your mouth, your nose, your eyes. So all those kind of things. But yes, we have to go back to normal life, but we have to do it slowly. But surely we have to do that because this is what is happening right now and we have to do it. So I would not advise staying home, but I would advise having some caution and slowly going out with some precaution.
Okay. Another question came. This one is more in regards to wearing gloves, and a lot of individuals feel that if they wear gloves, then they might still be further at risk if they're not practicing it safely. The glove. So how do they effectively use the gloves? I mean, should they wear in both hands, or should they wear in one hand? Some people they're seeing people using both hands, and some people are seeing in one hand. So there's a bit of a confusion there.
So first question is, why are we even wearing gloves? What are we trying to avoid? We are wearing gloves thinking that, oh, if there is a virus, the virus is going to touch the glove, not my hand. You know what? If the virus touches the glove and you touch the same glove to your mouth, to your nose, to your eye, it is the same thing. You will get the virus. So wearing glove gives you a false sense of security. It does not help at all. Now, it's one thing that you wear a glove for a short period, you do some stuff, and then you immediately take out the glove. A lot of people are wearing gloves for a longer time, which means they will unconsciously touch perhaps their face, and they may not wash their hands as much. So if you're wearing a glove for a restricted period while you're doing something, that's perfectly okay. If you're wearing a glove thinking that you're going to avoid the virus, I would not advise it. I will be without any gloves, but continue to wash my hands and using sanitizer. So you just need to be careful. Now, wearing the glove in one hand or two hand, same thing. Don't feel that glove is giving you protection because it's a false protection. Gloves can be worse than your hand because people don't wash their hands when they're wearing gloves. People don't wash the glove hand. They don't use the sanitizer. So it's a false sense of prevention as opposed to not. So it's not necessarily ideal, except for a short period when you're maybe doing some stuff and you want to really completely avoid any contact.
Okay, so another question came, and this is more from the community here in Sugarland, specifically as individuals are starting to get back into their spiritual places such as mosque, and there are some mosques that are opening up again. I think soon. I'm not sure the exact date, but the question is how as they pray on a rug. how long does this really stays the germs on the carpet?
Yeah, that has been changing almost every week. Right now, we know that it stays on fomites and carpets and those kind of things, maybe few hours, and it changes. But the thing is that so many people would be using that carpet that, first of all, mosque did open from yesterday, which is the 28th, or actually today, 28th. So they should have opened today. There will be a Friday prayer perhaps tomorrow in some mosque. If we are going to a mosque, we need to take our own rug. We don't need to use their rug. And mosques have already advised that. They have already clearly advised that no ablution, meaning no wudu there. You have to do it from your home. Bring your own prayer rug, and you have to be 6 feet distant. So if you can do all of that, okay. But that carpet, it's not only the carpet, it is so many things which are there. It's not one person's germ if you're using their carpet, it's many people's. So please, God forbid, don't use that. Take something from home and use that and try to keep a distance whenever possible. The worst part about the mosque is, which people don't talk about, is while mosque is very big usually, like Maryam Masjid is big and now Sabreen is big also. The problem with these mosques is that the entrance and the exit door is usually very narrow. So everybody's going in at the same time, and more so, everybody's coming out almost at the same time. That's when you are more than likely to catch an infection, because the social or physical distancing would not be possible at that time when you're entering, and especially when you're leaving. Please be careful about that part.
All right, thanks for that wonderful suggestion there for individuals that are getting back into the prayers, and especially at the mosques. Okay, so I think I'm waiting for additional questions. If people have, do provided. We have a few more minutes left, or actually 2 more minutes left to close this presentation. But definitely we can welcome as additional questions. They can reach out to you if people have questions. What is that particular contact that they can give, that you would like to give for the audience if they want to reach out to you?
Through this channel also, because of course if they tag me, I will get the question, and that perhaps would be the easiest way for them. They don't have to remember anything.
Okay, excellent. Right, and one more question, and this is more, I guess this is sort of the same question as the earlier one as I read this. Physical distancing. So if individuals are going into the park with their kids, what do you suggest? Like how long this really stays in the? I think you might have already answered this. I think how long this germs or stay in the air, and how long?
So the germs stay in the air no more than few hours, but the intensity decreases because the germs tend to go down. The problem is that if you are less than 6 feet, the germs can travel, stay there, and you need only a few minutes, usually more than 10 minutes, they say. Previous studies was 5 minutes, now they're talking about 10 minutes, and one can catch. So if you are more than 6 feet away from somebody, you're usually safe. If you are less than 6 feet, and especially less than 3 feet, then there is a problem, and you need to be very careful. So they will stay there for maybe an hour or two, no more than that usually.
All right, and what about like using public restroom?
That is one of the worst parts. Yes, okay. Public restroom is one of the worst things because they're very usually narrow. They're usually very small, so you have to be very careful. While the new studies are showing that the virus is not sticking to your door handles and all for that long as we were thinking before, or if it sticks, the infectivity is not that high. Still, there are quite a few things in public restrooms because they're very small. There's not a whole lot of ventilation. So if you can avoid it, please do avoid, definitely.
And how about these credit cards or these wallets and?
Yeah, those are mostly okay. Why? Because as much as the virus stays there, whether it is a handle or so, the latest studies are showing that the infectivity level is not that high. What we are seeing right now is that infectivity level of the virus is highest when we have a person-to-person transmission. So if I sneeze, I have fever, I have cough, and you are less than 6 feet from me, that is the worst way, or perhaps the most effective way to catch a virus. Others, people can catch, but even if they catch, they may be asymptomatic carriers, so meaning they won't be in that severe of a disease. That's what it's showing right now.
All right, I think that's pretty good. We can wrap this one up. I ask all my members of the series that people join on the series as a guest. This is very focused on the leadership series. So, who's that one individual you look up to as a leader, or could be few that you could mention that you have been inspired by?
That's a tough question. It depends on what you're looking in a leader. Like if you're talking about humility, passion, I always look at my father, who's not alive, because he was perhaps one of the persons who was always who will talk to everybody with humility and all of that. If you're looking at decisiveness, courage, I remember my mentor when I was doing residency. He was my leader in that sense. So I think it's hard to say one person because truly, ideally, one should pick up good qualities from few people and then make it one. So it will be few people, of course.
Thank you again, Dr. Asim Shah. Really great advices and insights, and I think the presentation will definitely share, and it's already on here that people can look up to and review. And if they have particular questions, they can definitely answer it. They can question it during this presentation they're watching, or they can directly contact you as well.
Thank you.
Thank you so much for your valuable time. Really appreciate it, and key value advices.
Appreciate it. Thank you for doing it.
Thank you so much. All right, so that was Dr. Asim Shah, who really has been a servant leader, providing so much insights, information, key valuable information for the parents, for the community, for the individuals, business community members, and at the same time, how to deal with your child effectively, especially in today's crisis. I think that was the topic, and he definitely has provided, look out for some of those signs, build a relationship with your children, be very truthful, be honest, and continue to remain compassionate. That is definitely the key takeaway that I take more personally. He also provided some wonderful apps to look for that really can help further with the current situation, especially that their children are going through, stuck at home. They might be take advantage of some of these apps, and of course you need to still take them out, but at the same time in a more careful manner, like maybe to parks, but do physical distancing. That is the terminology rather than social distancing, because we can still socialize and be at the same time safe. All right, so that's pretty much it. Thanks for watching. We have next one guest on the leadership series in about 25 minutes would be Judge Dedra Davis. She will be joining. She's a judge of Harris County in one of the 217th, I believe, the district, and she will be providing her insights on the leadership series, on specific to how she's practicing leadership and how one should be practicing as a leader in today's crisis, specifically in regards to the judicial system, in regards to the justice system. And we definitely heard a lot of news things came up, especially in the recent. She's going to definitely provide some insights there and how one should be practicing as a leader, especially in the judicial system. So thanks for watching. Really appreciate it. And we'll be back with in 25 minutes with additional guest, Judge Davis. Thanks for watching. Take care.